So what I'm going to do is I'm going to show you how to change a pump cannula. So the first thing I'm going to do is I'm going to make sure my hands are clean, so I'm going to have washed my hands. And then I'm going to make sure that I've got the equipment that I need ready to go. So I have a reservoir, I've got my cannula, I've got my insulin, and I've got my pump that needs to be changed. So I've disconnected my pump from Lenny, and I'm going to take out the old reservoir, and I'm going to put that there to discard later. And then the first thing I'm going to do is I'm going to rewind my pump. So I'm going to press the Act button, I'm going to go down to the reservoir and set menu. When it's highlighted, I'm going to press Act, and then at the very top it says reservoir setup. So I'm going to go up, so reservoir setup is highlighted, press Act, and the pump will then say, do you want to rewind? I'm going to press Act again to say yes, and you'll then see this little black dot at the top of the screen to say the pump is no longer delivering insulin and it's rewinding. So I'm going to sit that down. So then what I need my reservoir and I need my insulin. So I'm going to take my reservoir out of the packet. And then what we want to do is we want to push air into here. So I'm going to pull back the plunger so that I have air in my reservoir. I'm going to hold my insulin on the surface and I'm going to push hard down so that it clicks. Then what I'm going to do is I'm going to push down here to push all the air into the insulin. So I'm pushing all the way down, and then I'm going to hold that down even though I can feel some pressure. I'm going to invert the whole system, and then I'm going to let go, and you'll see that it automatically starts to fill by itself. And then I'm going to give it a little bit of a pull, but I'm going to do it really slowly until these two little black rings are down the bottom. I can now see that there's some air in my reservoir. So what I'm going to do is I'm going to flick. That allows the air bubbles to rise to the top of the reservoir, and I'm going to gently push those air bubbles back into my insulin vial. I'm going to turn the whole thing back again, and I'm going to take my reservoir off the blue end, and I'm going to sit it on the table, and that way it's going to keep this area here clean. And I'm now going to take off the blue transfer guide from the reservoir by pulling, and I'm going to throw that in the sharp spots at the end. The insulin can be left at room temperature, ready for the next time that you're going to do a cannula change. So we're now going to connect this reservoir to our cannula. So what we need to do is take the plastic covering off around the edges first of all. And then there's some paper, so I'm going to peel the paper cover off too. Now the cannula comes with its own insertion device, and we have ridges and dimples. The ridges are where we hold it to do all the preparatory work. The dimples are where we hold to actually insert the cannula itself. So we're going to hold the ridges and we're going to flip the lid off, and there's a little ridge on the lid to flip the lid off. Then we're going to unwind the tubing. And then we want to connect the reservoir to this end. So I'm going to hold the tubing in one hand and the reservoir in the other, and I'm going to gently place and gently apply pressure. If it doesn't go in all the way, I'm going to twist the reservoir until I can feel it give, then push all the way in and then twist to lock. I'm going to have another air bubble check here. I want to see whether I can see any air bubbles in this reservoir. If I can, we're going to flick, wait to see the air bubbles rise. I'm going to gently apply pressure to the plunger, and I just need to see the air bubbles in the tubing. I don't need to push them all the way through because the pump's going to do that for me. Just into the top of the tubing, and then I can untwist the plunger and we can get rid of that. We now need to put the reservoir back in the pump. So the pump's going to give us step-by-step guidance as to what to do. So the pump's saying the rewind's complete, place and lock the reservoir in the pump and then press act. So we're going to follow the instructions, place and then twist to lock the reservoir in the pump and press act. The pump's then going to say a reminder, are you disconnected? Yes, we're disconnected, act. The pump's then going to want to fill this tubing to get rid of all the air. So we're going to press and hold the act button. Going to pick up the cannula set and face it downwards because we want the insulin to drip out of the tubing and we don't want to get the plaster wet. So I'm going to hold the act button until we see drops coming out from the end of the tubing. We can now see drops, so we know we've got rid of the air, and I can release my finger from the act button. The pump's now saying press escape if done, so press escape. And the pump then gives us a reminder, do we see drops at the end of the tubing? Yes, we've seen drops. And the pump says connect set to body. So that's the prompt that it's ready to be put into the child. So I'm going to take the plaster cover off the plaster. And then this insertion device works on a spring mechanism. So we need to hold the blue edging on the ridges. And then on the white part, there's a middle part that has a little place to hold. I'm going to hold that and then I'm going to pull the spring mechanism until it clicks to lock. I want to make sure I remember to take the needle cover off, so gently pull on the blue tubing, which is the needle cover, and that's ready to go. So at this point, I'm going to get Lenny. The cannula can go either into the stomach or the buttocks. I'm going to demonstrate here in Lenny's buttocks. I'm going to pick up the cannula. There's a little ridge in the tubing just to put the wire through, and then you're going to place it on the skin. Now the wire, you want to have the wire facing upwards so that when Lenny's trousers are on, the wire is facing up, and then you're ready to go. So at this point, the insertion is you're going to hold the dimples. So by pushing both of the dimples, it's going to push it into the skin. So 1, 2, 3. I'm going to very gently apply pressure just to make sure it's in. Then I'm going to put a finger on the wire and I'm going to hold the blue outer casing and gently pull. That pulls the needle out. Need to make sure that the plaster is stuck to the skin, so I'm going to gently rub the plaster. That just makes the adhesive work. And that's the cannula now in. Now the final step to remember is the needles come out, so we've got a little bit of tubing into Lenny that's got air in it and no insulin. So we need to fill that tubing with insulin. The pump's going to remind us. So I'm going to press the act button, and to fill the cannula we're going to put in 0.3 and we're going to press act, and that's now filling that little cannula in there. It's not going into Lenny, it's just filling the tubing. At that point you're finished. Lenny's going to go off and play, and in 1 to 2 hours we're going to check the blood sugar to make sure that it's still in target range. If the blood sugar was starting to creep up, that might be an indication that that cannula hadn't gone in properly, and that's done. The final step would be to discard the sharps in the sharps box. So the blue transfer guard in the sharps box, and then the insertion device for the cannula. Now the inner white part with the sharps can go in the sharps box, the outer coloured plastic can go in the recycled box. So to do that, push here and here, separates the two parts. This part goes in the sharps box and this part goes in the recycling box.